There's more COVID in the community, and the chances of you being exposed are even higher.
Dr. Dean Sidelinger sharing some sobering news during a virtual press conference Wednesday. The state epidemiologist says the COVID-19 pandemic is nowhere near over.
What we're facing right now is a predominance of the BA.2 subvariant. We know that we've detected our initial BA.4 in Oregon, and we expect additional subvariants from the BA.4 and BA.5 subvariants to show up in Oregon.
Sidelinger says this revelation will most impact those at higher risk of becoming severely ill from COVID, even if they're vaccinated and boosted.
Those with underlying medical conditions or who are immunocompromised should consider contacting their healthcare providers now to make a plan to get tested and receive treatment should they become ill.
Sidelinger says in recent weeks, the daily reported case count has jumped from an average of 600 cases a day to 1,350, and hospitalizations have gone up too, from 110 to 250. Sidelinger says despite all of this, he does not anticipate the state implementing any drastic measures like a statewide mask mandate. Instead,
I think individuals can assess their own risk, their own health conditions, who they live with, and whether they're older adults, immunocompromised individuals, or folks at higher risk.
Taking charge of the situation now, Sidelinger says, will pay off later.
If we each take steps to protect ourselves and our loved ones, COVID-19 does not have to dominate our lives. Being vaccinated and boosted is the best way to protect ourselves from severe disease.
All right, Dr. Sidelinger says no part of Oregon is immune to what's going on. He says risk of exposure and infection exists in every community across the state. This, of course, is concerning with only a few weeks left in the school year. Should the situation worsen, schools are encouraged to try universal masking before wrapping up the year remotely. Brittany.
All right, really important info there. Thanks so much, Mike.